I'm glad to introduce our next speaker, Dr. Vishal Jha. Dr. Vishal is a founder of IMEDscholar.com. He's a pediatric resident at BJ Wadia Hospital for Children. He runs tribal health project in 75 villages and mother and child health projects in 50 urban slums of Mumbai. He has led many NGOs from social sensitization of medicos to leading efforts of a multi-state cancer foundation. He is the ex-head of a business at Y Combinator Company, and he has worked as a consultant to many startups like Marrow, Aerogram, Sketchnote, Mars, Weevil, Medplasm, and others. For this very short intro, I'd like to welcome and invite Dr. Vishal Jha.
Thank you so much, Venkatesh. At the onset, I'll like to apologize for the setup. I'm actually on duty. I'm currently posted in pediatric emergency department, so I took a short break and came. So this is, by the way, my hostel mess. This is the only place where I could get enough internet to conduct this talk. Anyway, so we'll start. I'll share my screen. Just give me a second. Also apologize for using my mobile because again, that is all that I could arrange right now. Give me just a second. Yeah. The screen is visible, right, Venkatesh?
Yes, it is.
So basically today what I've been asked to talk about is primary healthcare technologies. Now I have a bit of experience in this because this is what I've been working for since last 3 to 4 years. It started since like when I started visiting villages and I saw the problems there, I thought I'll do something there. So it started by me going there once a month or maybe say twice a month or maybe going there for a few days and trying to do something that I can. But gradually I realized that it would not work. I cannot go there for 4 5 days and expect some real change to happen. And I wish to have a real sustainable project, and I was lucky enough to do that in Palghar. That is, 1 second, sorry. So I was lucky enough to do that in Palghar, where we adopted 75 tribal villages and tried to give them end-to-end healthcare, right from basic primary healthcare up to tertiary care. So we did a lot of experiments there, and that is these are the learnings from the same place. So this is what I wanted to start with, right? So let's always start to define what technology is. When we think of technology, we always think of the digital stuff or the hi-fi stuff, but a lot of time they are more gimmicky, and the real solution lies in very simple indigenous solutions. We'll see more of it as we progress. Is the voice fine? I don't think it would be great, but is it workable, Venkatesh?
Yes. Oh, it's fine.
So if we talk about the application of scientific knowledge to the practical aims of human life, or as it is sometimes faced to change and manipulation of the human environment. Now, when you read this, it has a very broad application. It started from maybe wheel or fire or all of those things. It has been changing the course of mankind forever. If you look at like I recently subscribed Netflix, and I was going through first I was watching a series on samurai, the medieval Japanese era, and there I realized even the person who took over the medieval Japan, the samurai, Nobunaga, I guess that is his name. He also did that with the advent of new technology. That was the first time when they had something similar to a gun. So he used that to change the scenario there. If you look at World War II, again, it was Germany with their technology that changed the landscape. So it's always technology that changes a lot of stuff, right? That is that it changes how mankind looks. So one of the best invention that has happened, maybe, okay, I'll talk about it later. So I'll tell you what I wanted to start with. 1 second. So I don't know if you all are familiar with this image. Now this is like to give you context of this image. This was the Japan era, right? This is from Japan where when Mao took over as their leader. And when he came, there was widespread diseases all across the country. People were in very poor health and they did not have enough doctors. That is when he tried an experiment which was never done before, which was condemned by all. And what he did was he asked the farmers, the barefoot farmers, to become doctors. He trained them and they started acting as doctors. And of course, there was widespread criticism about it. But that is a concept that eventually took hold, and that is maybe the genesis of the community health workers that we have in the modern era, or the ASHA workers that we call in India. So why I wanted to start with this and why I called it as a technology, because no matter what you do in primary healthcare, any of the devices that we talk about in the upcoming slides would not be possible without community health workers. That has been by far the biggest technological or the biggest innovation that has happened when we talk about primary healthcare, because you can't have doctors available everywhere, and this barefoot doctors equipped with the right technology, the devices, point of care devices, have been able to bring all the solution. This is a picture of the real picture from the Mao era, and the one who is there, the lady that is there, she is one of the barefoot doctors. So now we'll talk about some indigenous solutions, right? So a lot of time we think that we'll sit in like some top colleges and we'll think of some solution, we'll provide it. It works sometimes, but more often than this, it is the indigenous solutions. People are working there on the ground who are there all the time. They come up with solutions which acts way better. So this is the first one. This is the anemia meter, right? So basically, it does a very simple job. If you notice, there are different images of tongues in the lip conjunctiva, and then the photos of lips and the tongues, and which has different HB levels. So basically, we use that, and there's a small mirror in the center. So you just show your tongue to the mirror, and then you see where your hemoglobin lies, right? So this has a great, because it is very easy for us to test the hemoglobin to a hemoglobinometer and tell it to the patients. But it's a very simple tool. It takes like 10, 20 rupees, maybe say maximum of 50, 100 rupees. But we can use this, and it has a lot of visual impact on the patients. So they see that, okay, this is where we are. This is where we started, maybe with very low hemoglobin. This is where we are right now, where we are somewhere in middle. This is where we want to be. And when they complete this, like when they actually improve the hemoglobin level, it is seen in the image. We try to give them some gift, like mostly say an iron tub or something as a gift. And that is what they use. This we are using in many of our villages where we work. And this has like, this is a very simple tool, but it has great wonders. Like, this is something that they all want is they take it from us and they see their tongue, then they see their children's tongue, and then they compare it with their other family members and all of those things, right? This is something that has worked wonders. This is again a very simple tool. Second is breath counter. So if any of you are dealing with the pediatric population, you know that pneumonia is one of the, or respiratory distress is one of the major cause of death or IPCU admission. So any morbidities or mortalities in the pediatric age group, this is by far the biggest reason of child death, right? And right now, as per the latest IMCI guidelines, it is very easy. You just calculate the RR. You like the way I do it in my OPDs. I start the stopwatch. I calculate the number of breaths in a minute, and that is it. I know if it is a pneumonia or not, right? So this is something that can be done by even the, like say, second grade pass or third grade pass person. But when we started working with them, we realized that they are not even able to know the, like when we are working with like say elderly females, they are not even comfortable counting those numbers, right, up to 50 or 60. So this is something that was prepared by Gadchiroli Search. Like, some of you might be aware of this. It's a simple breath counter. Sorry. So if you can notice, there is an hourglass at one end, right? And there are beads on the other end. So each bead represents 1 to 10 ka count. So the females or the community health workers who are working, they're very comfortable counting from 1 to 10. So every time they count from 1 to 10, they just put one bead aside, and they keep doing that after every 1 to 10 beats. And what they have to ensure is if the red bead goes on the other side or no. Red bead will go when there are more than 60 breaths, right? For neonates, and for elder ones, it is above 40 breaths, right? So for the comparatively elder kids. So simply by using this tool, by counting their breaths, they will be able to figure out if the child has pneumonia or no. Then they can refer them to us, or they can. We have a system of that too. Once they know it, they'll inform us, and then we'll do the needful. At some places, they have also been advised to give amoxiclav directly, but we don't do that ourselves. But again, this is a very simple yet effective tool. This is a hourglass which completes within 1 minute. They just have to count the beats. This third one, this is again very useful. So the basic thing that you'll do for any person that would come to your setup is you'll check their heart sounds and lung sounds. Now the problem is this is something that even medical students face, that the so the senior would ask, are you able to hear the murmur? Are you able to hear the creps? And you'll say yes, 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 yes. But you are not sure that whether what you're hearing is the same thing that the senior is hearing. This is a simple stethoscope. The only difference is it has two set of earpieces, right? So one a senior or doctor can hold, another community worker or junior can hold. This is a very fast way of teaching them heart sounds and lung sounds, which are very easy. They are mostly 4 to 5 sounds that you need to be aware about. And if you practice it enough, you'll know how to go about it, right? This again is an indigenous solution. This has been prepared by JSS Bilaspur. and it's also very cheaply available and works wonder in community settings, right? One thing that I did not mention here because it is so obvious right now is ORS. So if you know, ORS earlier had a antibiotic treatment in the protocol that you need to give antibiotics for AG, that is acute gastroenteritis, or what we commonly call diarrhea and diarrhea. But so when there was few doctors who were working in West Bengal and Bangladesh area during famines and floods, they realized that they don't have access to this. They don't have access to antibiotics. And the mothers there, they used to make this rice water paste and they used to give it to their child and it used to save them from dehydration. Then they started working more on it and they started giving that rice water formula. And that gradually led to the evolution of ORS in the current form. And that is now widely accepted as the go-to treatment for diabetes. Right? So it is also one of the greatest technological innovations I feel that has happened because it has significantly reduced the diarrhea deaths. And now even in hospital tertiary care settings, ORS is the mainstay of diarrhea treatment. Now we talk about the same thing but with a digital twist. Like we saw the teaching stethoscope here. Now another stethoscope that we use in our Palga villages where we are working is the AI stethoscope. Now this AI stethoscope, it looks, I did not use a stethoscope image because it looks just like any other stethoscope. The only difference it has is it can record the sound and it can also visualize the sound that you can hear. So even if there's a person like a community health worker who does not understand heart sounds and lung sounds, they can just put the stethoscope at the right places and then the sound would get recorded. They also helps to figure out if there's something wrong and it alerts us, or they can also, and when that would happen, they can send us the video or the audio along with it. So it visualizes and we can have it in our mobile. So even if I'm sitting in my hospital at Padia and there's a patient in my village who has this problem, I can see the visual representation of the murmur or the heart and lung sounds. I can listen to the recording. I can share it. I can use it to teach to my other people. Or next time, if I have a community health worker, I can tell them. And the person who is using it, the stethoscope, they'll be able to hear it themselves. For them, it works as a simple stethoscope with all these features. It does not even cost much. Like we got it around 15,000 rupees. From an NGO point of view, considering how much resources we spend, 15,000 per stethoscope is not a major cost for us. Another and the last thing that I wanted to share is an antenatal care kit, right? The care mother kit, as the company calls it. It's basically a suitcase with some instruments in it, a hemoglobin meter, a weight meter, a urine dipstick, and it has been associated with a mobile. So a major issue again in tribal areas is high-risk pregnancies. You can't expect gynecologists to be available in all the tribal villages in the current scenario, right? So this kit can be used by community health workers. It detects high-risk pregnancies which needs medical attention for which we can connect them to a gynecologist. I guess you all can zoom the screen and see. So you'll see a BP meter and all of those things. So basically the community health worker is trained how to use the BP meter. It's an automatic BP meter. There's a urine dipstick. And they just simply enter the parameters in the device. And the device is connected to the app and then we find all the parameters and through AI, it automatically detects it's a high-risk pregnancy or no. And we can detect it manually to when we have the data. And this is how we can screen all the high-risk pregnancies which needs further care, right? So these are basically the simple but effective tools. If you notice, none of this is very like high-tech or gimmicky. It's all something that works on very important problems that you face in tribal healthcare, which has a very simple solution. This is all I wanted to share. But again, I would end by saying that if you notice all the devices, all of them had community health workers at the heart of it. And that was a innovation with a human, not with like some digital technology that was used. A more recent uh, utilization of this human technique was, so tribal population forms 8% of the Indian population, but it carries the burden of 50% of malarial load, and which 8% tribals have 70% deaths of malaria, right? And that is also a major issue. Now, if you can simply get a smear of that child and you can see it under microscope, you can know it is malaria and you can start the treatment of the victim, right? Now, the issue is you cannot have those labs and microbiologists available in all the tribal villages. Now, what one organization did to counter this was they had community health workers who could very simply prick the child and make a smell, which was not very tricky. What was tricky was to have a microscope there for them to accurately diagnose. So what they did was, even though healthcare has not reached all the villages, lot of those villages still have education available. They have schools available. So what they did was the they had to ask the community workers whenever you have a patient with similar symptoms or with fever, you prick them, you prepare the smear, and then you give it to the household kids or to the local kids. Those kids all bring those smears in a brown wrapped in a brown paper, and they bring it and give it to the local this local grocery store, which is located on the main road. And that main road is where the travel buses and the school buses go from that to the main town. So those travel buses have been asked to collect all those samples from there and take it to the main town where they'll process all the samples. It reaches them in the morning. They process it by the evening, and then with the same travel buses that goes on the in the opposite direction, they'll send the samples back. And that is how the community health workers would know these are the patients who have malaria positive, and along with the samples, they also send medications for the same, right? And that is how within the same day the malaria gets diagnosed and the treatment starts. Anybody having fever, so maybe that is a treatment that even many city people would not have access to. So this is again a technology that is like working with humans, and it has great solution for a very major impact problem. So the solution has to be like, in my mind, from what I have learned over the years, the solution has to be pinpointed towards the problem. It should work on major problems, and you really have to think innovatively. It can only happen when you have been working on the ground over the years. This is all I had to say. Thank you, Venkatesh. Thank you, HeDaL. Thank you, Ayin.
Thank you. Thank you so much, Dr. Vishal Jha, for orienting all of us on primary healthcare technologies. Hope all of us will start thinking about thinking in this direction so that we get to innovate more such simple and powerful devices which can be used on the primary healthcare level. Thank you so much, Vishal, especially for delivering this talk amidst your duty.